previously you were at Y Combinator,
Mhm.
um, and then now you've done a lot since then. But I think it's always interesting when you're starting a new venture to kind of retrospectively look back and think what you gained for different experiences. So at
Mhm.
Y Combinator, I imagine you got to see so many different startups, so many different ways of doing things, and
Well,
you were a founder of HomeJoy and other things in the past.
mhm.
So when you set out to do Instalab, how did Y Combinator, that experience, like help you? Like, what did you draw from? Were there experiences, thoughts and that type of thing?
Mhm. I think, YC has a very large network of many amazing founders. And so being working on something like a health tech startup that I'm doing now, in which I previously, I have a lot of consumer experience, but not in health per se. And so being able to tap that network and, talk to folks and get help in places and just accelerate kind of my learnings helped a
Mhm.
lot. And obviously at YC when I was there, I got to see all the companies and just being able to um, pick up some nuances or just even large trends and stuff like that was very helpful.
Yeah. Well, I know one of the big things that you talked about a lot, even I think you were in many of the, I don't know if they were still there, but you were in a lot of like the courses that Y Combinator had. I enjoyed all,
Yeah.
like you would talk about like sticky marketing and that type of thing. So, I mean, 5 years, maybe like marketing is kind of like a stable thing. Like I think they're like maybe like how to do certain things changes, but like the fundamentals change. Um,
Yes.
I think like you had like a good firm understanding of that where,
Mhm.
it's like there are people that just like maximize what they're great at and then minimize what they're not good at.
Mhm.
But you've always kind of struck me as kind of like the board, like you just kind of go around, like you
Mhm.
just like are an eater of information. So I'm just like, um, were there were there other like are you now like really good at like operations or something? I don't know. Like, have you gained like another limb from being there?
Oh, interesting. I would say I've actually gone much better. I was a computer science grad out of college, but I didn't spend a lot of time doing web programming, and I did a lot of
Mm.
Python and did a lot of data work, and I'm more data science. Um, but this time around, I spent like over 60% of my time coding, and I
Mm.
enjoy it immensely. And I it's kind of like the safe space, the quiet space that I go to when, I can just, you know, kind of, you're just by yourself doing stuff. And then the rest of the 40% is either working with patients, do a lot of patient work and operational stuff. I would say I'm pretty good with operations. That's if you have to rank all my skills. But it's not maybe the most favorite thing I like doing. And so, oh, excuse me. In this startup, I've tried to get my hands everywhere, and I'm probably more of a generalist this time for longer than I was at my previous company. Yeah,
Yeah.
I think I'm having more fun being able to do a lot of things. But at
Mhm.
some point, the company's going to get to the stage where I need to, move into my proper space or proper place. But for now, I enjoy just being everywhere. And I do, a lot of people are surprised, but I send a lot of the customer emails. I do a lot of the customer service still myself. And I think that just harks back to, always doing things that don't scale, don't hire for things that you can still do yourself and you're still learning a lot. And that in particular, customer service emails and emailing patients, it's just another form of talking to users and
Mhm.
just helping me, understand what we're building and what we can do better.
What's the your favorite tech stack to work in right now?
We are using React. Um,
Yeah.
it's funny enough, I was always a Python Flask type person, and that's where I would always start. But my co-founder insisted on this whole JavaScript route, which I really didn't like. But I've been doing it for 2 years now, and it's quite quite straightforward actually. And there's a lot of
Yeah.
documentation out there and everything, so it makes it pretty straightforward. But yeah, we use React, Mongo. Um, that's about it. There's not too much. We don't do anything too fancy
Mhm.
with our stuff.
Yeah. Yeah, JavaScript makes sense. Like that's the first language I learned as well, about 2 years ago. Um, and it was the documentation side of it. I think people really love Python too. Well, people are very
Yep.
opinionated about these things. I don't know. It's like it's
Oh
just a
yeah.
way to communicate with the internet. The nice thing about
Yes.
if you, especially for someone who lived in Silicon Valley, the nice thing about learning JavaScript is you kind of get like that the Kevin Bacon effect with Steve Jobs because Steve Jobs really
Mhm.
popularized JavaScript. Like he believed
Yeah.
in it over I think it was Flash or something. People were
Yeah.
like Flashes and everything, and he was saying that JavaScript's going to be the future. And now people have it where people think if there is anything left of human civilization, if it were to be destroyed, it'd be written in JavaScript. So I feel like there's like something kind of nice about being a part of that ecosystem. At any point in this conversation, if you find value in it, please subscribe. It is hugely beneficial, and it tells Google and everyone out there that this is content worth watching. Thank you for everyone thus far who has commented, liked, subscribed, and told their friends.
It is a more readable language, I would say.
Yeah.
I think I gravitated towards Python because it's just more to me. I just like less words and just being concise, and so I will
Mhm.
gravitate towards any language that lets me do that. But I think once I let go of that whole thing and just writing, long strings and whatever is okay and making it readable, like it, it makes sense. It's totally fine.
Yeah. Well, another benefit from Y Combinator, just have like a varied life, is you have more people to pull in when you're ready to build something. Like I think there is when you're just starting out, it's like, oh, Uncle Jeb, can you do, but like when you have kind of like more of a roster, it's a little easier to know, like, oh, my friend over here likes this type of thing, my friend over here likes this
Mhm,
type of thing, and you can pull them in.
mhm. Yeah.
Which is more or less the question of like who was like the founding people that you wanted to pull together to build Instalab.
Yeah, so we're still a very small team right now. I mean,
Yeah.
what I needed, we needed obviously physicians, and we needed operational and technical talent. And this company, so my first company, HomeJoy, I started with one of my brothers, Aaron, and this company I started with my other brother, who's a little bit younger, Alex. And I think I've just sort of cheated my way through finding a co-founder by sticking with family. And
Hmm.
so I haven't had to, put in the hard work of finding a co-founder. Um, and then also my sister is also, she's a physician. She's a physician at Northwestern, so she's
Wow.
somewhat involved with the medical side of the stuff. She has her, she's not a co-founder, but we have her involved, and yeah, we bring on people who have the. I mean, the main thing for us is because we sit in the category of doing medicine slightly different than what is traditional. Like we need like people who think similar to us in the sense that this is kind of what we think the future is. And so once you have those people, and you always just want smart, hardworking people. That's like the two qualities you need. And um, I feel like personalities, yeah, sometimes can get in the way, but I think a good team can come together just by same mission, being on the same, having putting that mission's number one priority in your life, and being smart and hardworking.
Yeah. So we have been talking around a bit of Instalab, but we haven't set it up fully. Would you like
Yeah,
to give us the quick rundown? Just because I often will just start diving in and I forget to give people context. So what
yeah,
is
totally.
Instalab and what's Instalab's mission?
So Instalab we are a marketplace for proactive to get proactive testing and treatments done. And so this is anywhere from we provide advanced diagnostics to help you understand yourself. This anywhere from blood tests to different types of scans and stuff like that. And then we also have you can have access to longevity physicians who will help you with any sort of treatment that you need to help you improve your longevity, improve your health and lifespan. And I would say, obviously tackling whole health is very hard to do all at once. And so what I would say is what we're really, really good at is the doing heart health stuff. So this is helping people um, figure out, how at risk they are for heart disease, heart attack and stroke, of course, and all the comorbidities that come with it, and helping people lower their cholesterol, lower their blood pressure, and improve their insulin sensitivity. So, people who have insulin resistance, that's a precursor to diabetes,
Mhm.
things like that. And so those, I would say, of that cohort of people who are looking to reduce the risk in those areas, we're really good at helping them get them to an optimal state. Um, and hopefully soon we can, do more for other areas. Um, so as sort of a, what is the user journey that most people take? Most people come to us. We started off, and most people still start with this comprehensive blood work that we provide. We call it the longevity panel. We come to your home, draw your blood, And then there's these markers that we analyze, and we sort of tell you, here are the 4 to 5 things you should focus on. And we try to stack rank for you and try to make it, have the super um, easy to follow game plan to get you, you know, if you take a test in 6 months for say, or next year, like you'll be in a good place. And like I said, with folks who have heart health issues, we are able to provide complete care for those folks. That's anything from not just testing, but also, nutrition, fitness, and then all the way to medications. We prescribe medications. And then if you have other areas you need to focus on that we aren't quite ready yet to provide direct care, we have a concierge team that will find you like the best specialist in the area for you, in your area for you, and then book your appointment for you. And so we send you on a path. So basically, I guess what I'm saying is that there's a starting point with us. We either can cure for you, or we can triage you to the right right person who can take care of you. And so
Makes sense.
we just want to be. I've never personally had a physician that I wanted to go to and talk to, and who I thought had had my best interest in mind, in the sense that like really understood what I had needed. And I think that's a reflection, as you probably know, of the healthcare system in itself and how insurance works. And so we sort of are kind of parallel tracking against the current healthcare system and trying to build our own little version here to help provide care.
Yeah, makes sense. So I think I okay. So the customer journey. My dad has a potato heart, or he did when he was in his 40s, and he had a heart attack. So it's like something I need to be mindful of. So
Yes.
I'd call you guys. So like I imagine just like I don't have to call you guys. I just probably do it online. You're like a web person, so I wouldn't imagine
Yeah.
it's
Yeah. Yeah.
archaic with a phone call. But so I fill out this thing. You guys send something my way. Does it literally come my way, or do I have to go to a physical location, just like as a brancher?
No, so we try to make it convenient. So it
Mm,
starts with a blood draw.
yeah.
And so we come to your home, draw your blood, get the results. And then if you're pretty healthy, like the next steps are probably self-explanatory, and like you can do it yourself. But if you're at risk for something, we may recommend additional testing.
Uh-huh.
And on top of that, we may recommend you join our program and work with one of our physicians to kind of, get you along the way. And the you mentioned heart, family history of heart disease. So this is actually our bread and butter. We've worked with a lot of people who are at risk for genetic reasons, or just bad diet for like 20 years.
Uh-huh.
And so there are, aside from the blood, so the blood panel itself, blood testing, I would say gets you 50 to 60% of the way there of understanding um, your risk for heart disease. There are other tests you can do, and other things, and other things you can do when you're young to get ahead of it. And so I wish there was. In the beginning, I thought, I'm going to create this one program and everyone's just going to go through it and they're all going to get healthy. But the reality is everyone's different. And
Yeah.
we still actually, I can't just go click, 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 and then give you
Yeah.
the plan unless you're pretty healthy already. It's click, click, click. Okay, talk to the physician. Okay, click, click, click. And then, we still need you talking with the physician once in a while to understand where you're at, and kind of, how we can optimize your treatments, get you in a really good place.
Yeah. But are you familiar with Brian Johnson and Blueprint?
Yes. I haven't recently been following it, but I'm obviously very well aware of that, what it is. Yeah.
Yeah. Well, I've often wondered, like, so what I'm seeing here is that you take someone in many stages of life and you kind of help them get to the best possible heart health that they can get into, which means that they're going to get overall pretty healthy. And so Brian Johnson's kind of doing a similar thing where he's like spending lots of money to find. Well, I don't think it's like actually like averageable data, because like what you're saying earlier about people being unique. So all the data that he's gathered on himself means like if you have a Brian Johnson genetic and body type, then that's the route to go.
Yeah.
But we need
Yep.
kind of like archetypes of the, I don't know, like 13 to 14 different types
Yes.
of body types that exist.
Yep. Yeah, I mean, just to give you an example, we've had people in their 40s who are seem perfectly healthy. Their blood sugar levels are great, their cholesterol levels are fine, and the at 40, that's the marker. And this, if you have any sort of risk, we are going to send you to get a coronary calcium scan done. And it's like $100, and it's a 10-minute scan, a CT scan that looks at the calcified plaque in your heart, in your arteries in your heart. And
Hmm.
if you score anything above a 0, that's not good. If you score anything above a 100, that's very not good. And so that and by the way, this test, a lot of doctors won't. You need a physician order for it, and a lot of doctors, if they don't think you're that at risk, they're not going to actually give you the order for it. So this is one of the things we do is we don't ask questions. We're like, if you want to get tested, we're going to help you get tested. We're not going to like needle at why you want to do it. We
Hmm.
come with the ethos of um, you should understand your health, and we're not going to be in the way of helping you understand your health. I do think like in terms of medications and stuff like that, you still need an actual like barrier there, but in terms of testing, we don't. We try to remove those barriers for people. But go back to say like people with seemingly perfectly healthy have come back with these CAC scores of 800, 900. We just recently had a patient who came back with, I think like over 1,000. He had to go, he basically had to go to the interventional cardiologist and get immediate bypass surgery. And so these are the things, these are like tools that exist. They're, I guess what I'm trying to say is that there are existing tools um, that will for sure um, help you prevent a heart attack or a stroke. And it's
Yeah.
just having access to it. But like I said, we've had 4-year-olds who we get them that scan, and then they're on their way of not having a heart attack. And then there are people who have this condition called FH, which is you have just high cholesterol, genetic condition of high cholesterol, and knowing that when you're young is very important. Um, and because you need to get that down as soon as possible, because what's happens, there's a cumulative effect of there's a thing called LDL cholesterol, and it's really LDL particles that matter, and ApoB, and all these other things we can talk about. But essentially, if you have those levels for too long, over time, you exponentially increase your risk for getting for sure heart disease, and if not heart or stroke. And so um, it's like those folks, it's like I want to catch them when they're 20,
Hmm.
early 20s. Like I want to help them early 20s. If you're like semi-healthy, like maybe I want to help you when you're 40s. And so it's just a matter of, you know, we take anyone at any point in time, and then we do tell people like there's not, you're perfectly healthy. We should test you every 5 years for this one scan or whatever test and put them on their way. But then there are people that we want to aggressively help, and those
Hmm.
people we try to convince them like either go find somebody to help you with or stay with us, and we'll get you treated.
Yeah. Makes a lot of sense. With some stuff that there's an element of like people man like doing the work to get better. I have a friend who was having health struggles like just post COVID, and like most people gained some weight during COVID, and so he was struggling just like getting up and starting that journey. And so I threatened him. I told him like I'll get on a plane randomly. I'll find you and I'll ninja strike you randomly and just like go about my day. I never did it, but like he
Yeah,
thought I was gonna do it. Like I really sold him on it, and he
yeah.
lost like 20 pounds. But because in his head he was running from me. So I've kind of always wanted like a ninja strike team with health professionals. Like okay, like how likely are you to do
Yeah,
this or like commit to this or whatever? Like what help do you need? It's like well I need motivation. It's like I will find you motivation, which
yeah.
is kind of like maybe a silly thing to say with how serious what we're talking about. But I do see the point of like everyone's a little different in supporting them and how important that is. I shouldn't make
No,
light of
yeah.
it, but
Accountability is a huge thing, and people, even very motivated people, need accountability.
yeah.
And so, the one thing that we do, so with our one of our programs, we do frequent testing. So if we put you on a treatment, whether it's just diet or supplements or medication, we send you we make you test. We don't force you to do, but we do ask you to test every 6 to 8 weeks, because that is the length of time in which we believe
Hmm.
that treatment is going to have noticeable impact in your biomarkers. And we find that people who stay on this testing regimen are moving towards optimal levels extremely fast. And it's because you get this gratification and um, confirmation that
Yeah.
what you're doing is working. Whereas, like, when you go to your doctor right now, you have high cholesterol, they say, eat less fat and then come back in a year. And it's just sort of like, well, that's not helpful. And, honestly, some people, like, they can do this one treatment that works for a lot of people, but like doesn't even work for them. And so you kind of end up in this like frustrating cycle of not knowing. And that's why, just having access to testing is super important.
Yeah. No, I agree. I think it's like when you're losing weight, you don't really notice it for the longest time. Like if you unless you're tracking like your weight daily, then you kind of notice it more. But for a lot of people, they won't. Even when they lose weight, it's like, oh, I don't look different. It's like that's because you're slightly changing every day. You just don't notice it. So having
Yep.
this like
Yeah.
added feedback loop of hey, I can see that I'm getting better. Like actually, um,
Yep.
I see the added benefit there. You have mentioned and this kind of goes to cost, prescriptions, etc. There's Mark Cuban's like kind of cost plus type setup where they bypass the insurance, which is nice because insurance is really annoying.
Yep.
But it sounds like you have like plugged into the insurance network, so that people can kind of just go with existing plans. If I'm understanding you.
So we're in the process of, in general, trying to get our some of our programs covered by insurance outright.
Mm.
That's just a long process to go through. A lot of the advanced testing I do, though, unfortunately, will probably never be covered by insurance because they just don't. It's this whole thing of I would help you when you're sick, but I'm not going to help you if you're perfectly
Yeah.
healthy and prevent sickness. But right now, actually, we through our programs we cover the generics ourselves,
Mm.
meaning we don't use insurance for that. It's just actually it's weirdly much cheaper to go get it yourself sometimes than to actually pay the copay for the insurance for those drugs. For the branded drugs, so we do for cholesterol, we do we do PCSK9 inhibitors, we do glycerin, which is called the brand name is Leqvio, and those are much more expensive. They can be 500, over $500 a month. And so we do run a prior auth and try to get it covered for you. And it's depending on what insurance you have. Sometimes it's really easy. Sometimes you have to, have failed other medications first.
Yeah.
But we will know what that path is to get it covered. And so we'll kind of route you in a way if you can't afford paying it for yourself, we'll try to get you set up so that it can eventually be covered.
Yeah. So what states are you guys active in then?
We're active in all 50 states.
Oh, okay.
Yeah.
You
And
can,
DC.
yeah. So you have people okay, so you probably have like a contracting service, like local nurses or something that when someone buys something, they can go out there and get the needs facilitated.
So we have phlebotomists out in the field who do the blood
Yeah.
draws, and then we do some of the medication requires shots, and so we do contract out nurses who will come to your home
Yeah.
and give you that shot. And then all our consults with our physicians are virtual.
Okay.
So we don't do anything in person. And the reason why is like we don't do urgent care, we don't do any of thing that actually requires, usually touching and, prodding you. If for anyone, who does need that service, we will go find them a physician, a specialist to do that for them. Like for example, skin cancer checks, which everyone should do once a year, but almost no one does ever. That requires obviously, you need to go see a dermatologist, and so we refer them out to a dermatologist appointment. But otherwise, because we're sitting in the preventative space, we're able to actually do a lot of consults over Zoom.
Makes sense. Especially because it's not emergency based. I think this is something that you could potentially have like an emergency based type event. You see a doctor, they disappoint you, which happens, and then you see a service like yours, and it's like, hey, I have a long term need, and I can plug into you guys and have that met. See, I can see multiple people like getting to a point where it's like, oh, this is actually really, very helpful.
Yeah. I think the ideal setup is if you had an insurance that covers a service like this, a prevention-based service, and then you have like your emergency insurance for, um, you get in an accident or God forbid some other horrible thing, you actually need to get your hospital bills covered. But if you start, in your 20s with a prevention-based service, that should get you. You should be able to early detect everything, almost everything. I mean, not everything, but a lot of things you can early detect, at least the most common things,
Mhm.
and you won't need, to be on tons of medications or have all these surgeries later in life.
Yeah. Yeah. It's like the emergency room is like, if for people that kind of thinking in like what are the differences of the different stages in life. If you're going to the emergency room or you have an emergency event, that's like trying to catch someone when they're an inch off the ground. So
Mm-hmm.
a door's coming in when you're kind of like, maybe you have a limp. You're not even anywhere near falling. But that one person seemed like they were actually about to fall, and you guys caught it and then got them help immediately. So that's still pretty
Yeah,
cool.
yeah,
But this
yeah,
is like coming in like, oh, maybe I have a limp, and then you guys come in, it's like, no, you get people back to being, optimized humans.
yeah. If only also there were physical symptoms of when stuff is
Yeah.
happening. But yeah, a lot of times, it's through blood testing and all these testing that you can catch things before the symptoms
Mhm.
appear, which is why do you want to, obviously do it because you can't predict your inner self.
Yep. Are there tests that you're looking to add, but maybe right now it just costs too much? Like they're like maybe only for like the rich people or something. I know there's like these really
Um,
crazy stuff that exists, like these really crazy programs for athletes that go somewhere, they get like
yeah.
fully body tests and they get, which sounds
Mhm.
pretty cool. But and yours sounds like a democratized version of that, but for the heart. Yeah,
Well, yeah, so there are these very expensive executive health programs that cost I don't know, high tens of thousands of dollars, and you go
yeah,
for a day and they do the battery test. So we do actually offer all those tests that you do within that program, but you can a la carte it essentially.
yeah,
So we do by the way, we don't, some of the things, most of the tests are actually, we partner up with folks versus we actually do it ourselves.
yeah.
So DEXA scans, the full body MRI, these cancer tests and stuff like that. They're on our site and you can buy them individually and we try to get the best price for you. So for example, a Pronovo is a very popular, as all the celebrities always talking about the whole body MRI scan, and just it's trying to early detect cancer and find significant findings there. And if you do it through us, you can save like $400, maybe 500 bucks just coming through us, um, and instead of going directly with them. And so um, as I say, every test I just keep hammering on the price and just trying to get it down. There's the Galleria test, which is an early detection test for cancer. It's through one blood draw. Um, I don't like it's not something we recommend for people who have no family history of cancer. But if you do, it's one of the maybe top five things you could possibly do. But it is expensive. So if you it's $950 to do that test. Um,
Mhm.
we offer it for $900, $899, but that is just still too expensive, obviously, for most people to do. Um, trying to think of this thing, but there are some like if I was like if you're like hey, I'm 30 years old, I'm generally healthy, like what should I do? Like my our recommendation is going to be, well, it's going to be based on family history, so we might add things onto this list, but it'd be get your blood work done, or is your cardiovascular, metabolic, nutrients, inflammation, thyroid, all those basic stuff in order. That's in order, then we might also, and you want to optimize for longevity, you might also want to get a DEXA scan and the VO2 max done to try to optimize those levels. But I'll tell you, most people, they start with the comprehensive blood work and there's red somewhere that they didn't expect. Um, and so I do feel like some people are falling into this longevity trend of doing other fancy tests and treatments and stuff like that when they just don't have the basic stuff down that's going to cause them to develop a chronic condition. And so that's where we start first. Is we want to start from that level.
Yeah. So this actually goes to a listener question. Uh,
Mhm.
I don't know how to pronounce her name, so I'm gonna call him HJ. HJ asks, do you collect data and then they have a two follow-up questions based on that? Do you collect the medical data and do anything with it?
We don't. So we've been pretty. I mean, obviously we collect the data, and since we have blood work and we have a lot of their files, and some people send us all their data, and so we have like this Dropbox for health thing where you can just pile everything in there. And our intention at some point is to help you visualize all of that in a very
Mhm.
easy to way understanding. But we have no our path is in helping people. It's patient care, and so we don't have any intention on selling the data or doing anything else with it other than just keeping it with yourself and being able to help you understand it better is the only thing we'll probably do
Yeah.
with it.
So, yeah, in the age of like AI this or machine learning that, there's no plans to like aggregate the data for yourselves and then have more insight from that. Like then that sounds like something more like what the testing and other people would want to do. If your focus is just on patient care, I could see like that being kind of superfluous.
Yeah, I mean, there is probably opportunities to attempt to build like an AI doctor at some point.
Mm,
There's always that, that's the thing that everyone would like to do. We do it in the sense that we are only trying to help you using your data to help you.
mm,
Um, I've had people reach out to me like, oh, pharmaceutical companies only is blah blah blah. You're collecting a huge data set of blood work that's so valuable, et cetera, et cetera. And I think I just there is a huge business to build, I guess, in selling that data. But at the end of the day, I don't think that's gonna. I see ourselves already directly helping patients in this manner, and so I think that's just another company or someone else.
yeah. Speaking about the startup business side of things, I'm always curious what people have in place in terms of like it's like more like a president thing. Like the first 100 days, they talk about this. FDR
Okay.
proliferated it, but no one's ever thought of like the first 100 days for a startup.
Mm.
So I'm gonna coin this and like own this. But what were the first 100 days like? What were some of your priorities and some of the things you went through?
Oh man, the first 100 days, actually didn't have a co-founder at that time.
Mm,
He came on like 6, 7 months later when I realized I really needed a co-founder. The first 100 days were that's such a good question. It was a lot of I knew what I wanted to do, but I had no context at labs. I like signed up for a phlebotomy course myself because I was like, well, I don't know what a phlebotomist is, so maybe I'll just do this myself. I'm horrible at it, so I had to outsource that. Um, it was it was for a healthcare startup like this, it's just like honestly a lot of setup, logistics
mm,
and setup, and so it was finding, you have to set up a medical practice. You have to, I don't know, this might be going too in the details, but to run a direct to consumer healthcare company, you actually need two companies. You need the medical practice, and that's the one where the physicians are, and the phlebotomists and the nurses. And then you need another company that has a management agreement with this medical practice, and that's the tech company that is building the software and stuff like that. That company can't be one company for a number of reasons, all legal reasons. And so yeah, putting that, I think the 100 days was putting that in place and
mm,
talking with physicians who would work with us and talking with phlebotomists and trying to get the initial product out. I don't think we didn't. It took me a long time to nothing. I for sure didn't have a customer within the first 100 days. It was just I think it took us like at least 6, 7, 8 months before we had a product that like was we always talk about MVPs. It's a little bit harder these days because there's so many products out there now to build an
mm.
MVP. But with health, it's a little bit maybe this is just an excuse because I'm doing health, but and it took me so long to launch. But
Yeah, it is.
um, I think there's a place where there's a bar that you have to meet. And we try to run as fast to that bar as possible. But yeah, it took us a little while to get our customer number one.
Yeah. Well, the Y Combinator's, I think their recommendation is like you should build something or like have an MVP within like
Yeah.
46 weeks. I broke something. Within 46 weeks. So, but like medical takes longer. So like 5 to 6 times more than that makes more sense. Like I think that's fine.
Yeah, yeah, and yeah, you don't want to obviously do bad healthcare. That would,
Yeah,
that's like on the list of things to like f up. That's,
yeah,
number one you should not do. And so, yeah, you just need to be careful.
yeah. I mean, just look at Theranos. They're terrible.
Yeah.
Um,
Um, it's so funny because I spent so much time in labs and learning about. At some point, by the way, I wanted to start my own lab because I was like, this is ridiculous. I just need to do this, but it was a horrible idea for me. And I didn't do it. But yeah, it's funny because uh, reading and actually, I think it's just like watching one of the TV series. You like start seeing like, oh, that's what they're doing. They were like, this is how they're hacking the lab and this machine and all this stuff. It's just very fascinating once you know a little bit of the intricacies. Like I was like, oh, that all makes sense now. Like they were attempting to, they have this UI, this interface that, this is what's happened, but in the back, they're just scrambling around for doing all this other kind of stuff. And it's just kind of nuts that they were able to pull it off for so long. That in such a hacky way.
yeah, it's like the worst. It's like all the worst parts of Silicon Valley and startup things
Yeah.
were weaponized for something evil.
Yeah.
It
And
happens every now and again. Yeah.
yeah, and it caused a lot of strain on other companies that are legitimately trying to do something similar. Um, and and who are doing it correctly, obviously. But
Yeah.
I think the world is now hopefully over that episode, and that the lashback is, I'm hoping, gone at this point.
I think
Yeah,
it's more like sometimes people have like FOMO or feeling bad, like they're not good enough or whatever. And I
yeah,
think good feel that way,
yeah,
and then think, what could I do to counter that concern? So if there
yeah,
is a Theranos type concern, it's like, what can I do to over demonstrate to make customers and users and all these people competent? I think
yeah, yeah.
these things are
Okay.
like good things. Yeah,
Yeah, yeah, yeah. I agree.
yeah, yeah. So back to your first 100 days, but what when you were designing it out, was it just like Google Docs, a sheets of paper? Like for people who like listen in who've never done a startup, very interested in spaces and stuff like that, it is kind of fun to like get in the weeds, especially with someone who has
Um,
such an exposure. Yeah.
yeah, I think. Well, my first version is I built it for myself. And
Mm-hmm.
so it was just like, yeah, it was Google Docs and trying to string together positions and stuff like that so I could get this experience myself. And the first, we do a wide breadth of things right now, but the very first product we had was um, uh, uh, the comprehensive panel that you could get done. And just click a button and someone would show up and draw your blood and you get results in a week. And so I just did that a bunch of times myself and had some friends. I was in New York, and so I have 6 friends who got a lot of blood work done over the course of 4 to 5 months. And it was just a lot of trial and error, making sure, I mean, it's just things you learn about, you know, you got to package the specimen correctly. You got to, do all this and like making sure everything gets transported to lab correctly. These are all things at a certain scale that, you have to get right, so that, the test results are accurate. And so just ironing out those logistics on the operational end was a lot. That's what I was spending a lot of time doing. And
Mm-hmm.
in terms of the actual app and the actual website and stuff like that, I feel like I didn't have anything for the longest time. Like I brought in a couple folks and just trying to build something out, and just I think it was more at that moment I figured out the operations was the hardest piece I had to figure out first and just focused on that.
Mm-hmm.
And then I think I was trying to figure out what the first version of the website was. Probably something. It was horrendous. It was like this very dark website and just like too intense. Like the feedback was, I was like, God, this looks very intense. Um, uh, and um, too dark and blah 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 blah. But it's now, I think we've gone to a better place. I still don't like our design, but it's it's usable now. And I think we we still to this day focus most of our effort on the operations and logistics and the care piece of it. And we're now just starting to get in the mode of actually making our app extremely usable and like so that it complements the other stuff that we do versus it's
Yeah.
just like a utility tool to like book something.
Yeah. I was talking to someone this week, and they were asking for my feedback on something, and I said it looks good enough. And the response was, "Well, if the goal is to be good enough, looks good enough is what I want to hear." That's just really funny. It made me laugh for a while. So in terms of things that you couldn't do yourself, the probably the legal side of having the two different entities is something you had to find like a legal person to help you out with. And then paying
Yeah.
for that, a lot of times they'll just they set it up so they get paid when you get VC funding and stuff like that. Were there other things that you needed to like partner with people in your first like getting things set up, like a legal expert?
Yeah. So let's see. I had to partner with someone to help me understand, like fast track, accelerate my understanding of lab space. And
Mm-hmm.
so I was able to bring on for a short time this guy who used to own a bunch of labs in California, and I think his labs actually went through an IPO at some point, so he had a public lab company. And so that helped me on that front. And yeah, we have physicians. So again, was grateful that my sister could be our initial physician, but like she can't do it full time. So it, at some point we brought on Steven, who's another physician that works a lot with us, who has helped us develop a lot of our product. And so bringing those folks on. So legal, well, I say in order of priority, it was physician, lab person, and then legal. The legal is a little bit not as hard in the sense that it's a little bit specialty to find someone who
Mm-hmm.
can easily do this, but once you find that person, it's just pretty straightforward.
Yep.
And there are probably like a handful of lawyers if you start a healthcare startup right now. You just pay them, X amount of dollars, and it just gets them.
Yep. So we're for the initial stages of it. Let's say the first like 7 months until you had your first customer. Was it just like you kind of financing it yourself, or did you do a round then start working?
Yeah, I did I financed it for a little bit myself, and then once I had started to hiring people like phlebotomists and physicians and stuff like that, I did a round. We never announced a round, but it was in the low single digit millions, essentially.
Just the low single digit millions. Okay. Here's a question that I have for totally no reason whatsoever. Anyone listening
Yeah.
could not read into this question. Let's say you have VC money. Where do you park the money so it doesn't just get wasted in a checking account?
I put it into my general advice is don't get fancy with it. Like don't put it like some
Mm-hmm.
people put it into crypto and it just
Oh, that sounds
disappeared.
nuts.
Yeah, but I mean I put it you put into like the interest rates were great for a little bit. Like I put into the a CD account. It's like
Mm,
5%. You park
yeah.
like a million in one of those things, and you're at, for a little while you're just making more money from that than you are from actual customer revenue.
Yeah.
So yeah, I would immediately do that. And the thing about and their savings, I mean, it's probably gonna lower at this point because the interest rates.
Mhm.
But um, uh, you can put a savings account or just a CD. The problem with CD is you got to like park it there for a little bit. But if you raise that much money, you can just put some in a checking that you actually need, and then just put the rest in the CD.
Okay,
But
that makes sense.
I'm not a financial advisor in that sense. But
No.
I feel like that is the super safe thing to do.
Okay, good. Yeah, no. Yeah, anything we've talked about today, there's no legal advice going on. We're just talking. We're two nerds having the next conversation.
Exactly.
Please don't come to us. Please
We're
don't come to us.
definitely
If
not
someone's out there,
lawyers.
yeah, someone's out there like, I'm gonna study. I'm gonna like watch a YouTube video on how to be a phlebotomist. I'm gonna like
Yeah,
join Adora
no.
startup. Um, okay,
Phlebotomy is just oh man. Anyway, I phlebotomy is like you have to have a certain touch. And it's not just like you can learn the science of it, you can do it. You gotta like because you gotta feel the person's
yeah,
veins,
it's a wet noodle.
and stuff like that. Yeah, yeah. And it's
I've
well
had to do
people who
that.
can do it well, yeah, or you've
Yeah, I've
drawn
had to
blood from
do it on
someone?
myself. Yeah, no, for myself. There's
Oh,
like a medication
wait,
I had to take
what?
for the longest time where I had to find my own veins. And I was like, if heroin
Oh,
addicts can do this, I
Jesus.
can do this. So then I got through
Yeah.
it. But like for the longest time, my
Okay.
hands would shake while I was doing it. I was like, this is really hard. I really hope I don't give myself an aneurysm. Nobody trained me on this. There was supposed to be like a nurse that comes out and like showed me the first one. but it was during COVID. And so they're like,
Oh my
yeah, you
God.
just gotta figure it out. And if you start seizing, call someone. It's like, okay,
How do you know
it's nice.
you've done it? How do you know you've done it correctly?
Honestly, I feel like I have gotten a little dumber over the years, so it's possible. Like,
But interesting.
no, I'm doing it
There
right.
are there are you ever see those videos of robots that are one day going to draw our blood? Or
I saw the Neuralink one where they go with all the with all the stuff going in the head, which is kind of scary.
yeah,
So I imagine it's
oh
like
boy.
scary like that is what you're describing.
Yeah, it's I'm just I feel like it would be the most accurate way to draw your blood in a painless way because it can sing. Um
Yeah,
but it still just freaks me out a little bit.
yeah.
There's no
Well, you wouldn't be
bedside
able to
manner. A
move.
robot has no bedside manner. They're not
Most of
coming
the
in and
phlebotomists
out.
don't have that either. They're one person. I witnessed someone ahead of me that was a new phlebotomist who like pierced went to the other side and hit the vagal nerve or whatever. And the
Oh
only reason I knew
Jesus.
what the nerve it was is because they sat there saying, "Oh, I hit the vagal nerve," as the person was just vomiting. It's like, "Oh, don't worry,
Oh
this is just the vagal
no.
nerve." And it's like, give the person some stuff or whatever. I don't know. So, like,
Yeah, yeah.
what you've done, all this, like, to wrap this around and make this useful, other than just an aside, um, it takes real work to do what you're doing well.
Yeah.
This is not like, it took months or whatever, but like to get phlebotomists that could do it to a certain level, to get the support structure, like these are not trivial things. It's the way I'll take the aside that I was making and make it useful.
Yeah.
um but okay, so park the money there. You never announced the raise. That's usually weird. Most people like the free publicity of that. Was there like a
Yeah.
trade-off logic for why you didn't?
I don't want the publicity. It's just the inverse of that.
Yeah.
I generally am anti announcing that um like it it can give you attention, obviously, and sometimes the attention isn't great. But if you are hiring and stuff like that and aggressively, like that is the perfect reason to do it. But you need to do it because it when people Google search you or whatever, like it'd be nice for you to do that. So we've held off on announcing it just because I don't have the personality of like I really need everyone to know I can raise money. But if it will help me in the future, I will announce. I think my last company we raised a bit of money pretty fast, and um, after we announced it, I didn't think it was very helpful and just got us a lot of attention and people poking around at us that I thought it was a distraction for us.
Yeah.
So I just want to be more intentional next time we announce this kind of thing.
Yeah, the headlines for those things are always confusing to me. It's like X raises this. Like, what do they do? Why should I care? I don't care about the money. Tell me what they did.
Yeah, yeah, exactly.
Yep.
Yeah, I would love more stories about what companies actually do and
Yeah.
how they're helping people and stuff like that. That'd be cool.
Yeah. Well, we're living it right now. So, you did mention in our like because I always ask people questions before they come on, because that makes it easier for me to like generate stuff. That's
Yeah.
You did say there were some like pretty crazy case examples. I imagine one of them was going to be saving that person's life who went from having a test to like, hey, you should see someone now. But were there other ones that
Yeah.
you were thinking of?
So we've had like actually a number of those cases where they got that one scan done and then one put them on a path. And some are more severe than others, but I would say we've had a few cases where DEXA scans are popular for body composition, looking at body fat and visceral fat and muscle health, lean muscle mass, and stuff like that. But the Dexa scans, you push another button on that scan, and it does a full-on comprehensive bone density assessment. So how at risk you are for fractures and stuff like that, osteoporosis, osteopenia. And that scan is usually not recommended until you're 65 years old. But when you think about one of the most life declining moments in people's lives, it's a hip fracture or some kind of thing that makes them immobile, or not very mobile. And so we've been running some of these scans, and we don't actually like, actively recommend it to people. Like, you must get this thing done before anything else. Um, but people do, or we allow people to order, and they order this bone density scan. And then we've had a number of people who have come back with osteoporosis at a very young age, 40 years old, like 40-year-old men. That's not, you never would guess that. And there's right. And then so once you find out you have low bone density, like you have if you figure it out early enough, there are medications you can take to help rebuild that bone mass back up, so that you don't end up in a situation where you fall down and then you can't move very well for the rest of your life. But yeah, and then there are reasons for why you have low bone density. So we had a case of someone had silent celiac disease for a long time and was just losing nutrients, and caused low bone ants. Yeah. Anyway, I don't want to get into specifics, but essentially, um, it's interesting because, again, like the CT calcium scan, these are not tests. These are very cheapest tests. They're like $100 tests to do. They require, again, a physician order, and so there's another barrier on top of that, and insurance almost never covers it, so another barrier. And just doing it put them on a probably completely path in life in terms of long-term health. So yeah, and yeah, I could probably go through more, but I mean, those are like, it's just like these interesting moments where you just think, okay, well, it seems like osteoporosis, low bone density is probably underdiagnosed because no one is taking this scan until it's too late, essentially. And so same with heart disease and stuff like that, with that calcium scan, it's severely underdiagnosed, and we diagnose it after you've gotten a heart attack, essentially.
Yeah, it sounds like we need like cost plus for tests, just so if we can like really eliminate the supply chain. But if they're like, women tend to have bad bone density, so I wonder like what would be the value of just, I don't know any women that take bone density. They take supplements, but I didn't know there's like drugs you could do to like help with that.
I mean, that's when in more severe cases, like if you do have full blown osteoporosis at age 40, you need to go see an endocrinologist or someone to figure out the source of it. And then also there's these medications, like it's a shot essentially that you take once a year. Again, not medical advice, is just, on things that can happen if you get diagnosed. Yeah, women after menopause, that's the time where there's, a decline in bone. But what we tell people is, you should get the scan done at X point in time, any point in time, it doesn't matter. And then you should do it. If it comes back normal, great. Then do it every 3 to 5 years so you can track the changes over time, so that you know when there's been a normal bone loss or increase or degradation of any biomarker, really. And so, yeah, it's just about getting your baseline done at some point and then just going from there. And we're not telling people obviously to get Dexa scans like once a year. That's way too much. Or these bone density ones anyway. We say every 3 to 5 years, essentially, depending on who you are.
Yeah. Well, there's so many different situations where people are getting things earlier. So like earlier and earlier, like there's the Chadwick Baldwin, I think the Black Panther guy. He died of colon cancer. There's a lot of people like just getting stuff earlier and earlier. So even like we were saying a minute ago, that the recommended ages to even test for these things are like way on, but we're seeing these things emerge earlier, which I wonder to the extent like they're just probability distributions, or if it's actually just a low, like something has happened in the environment that is causing things to happen sooner, like microplastics or something like that.
Oh, yeah. I mean, okay, so we could list a lot of things, but things like diabetes and heart disease are clearly a reflection of the American diet. And in terms of, I mean, I think I don't know much about this, so don't, I might be saying something wrong here, but people are saying that there's been an increase in cancers. Yeah, and what is that? And so trying to find those causes would be good to know. But as a result, I think, the ideal scenario is if insurance or whoever, you can sign up for a minimum amount of money and like, tell them everything about yourself, and then out comes this testing plan. And then you just go to a place, you spend 2 hours at that place, and you get the things done. And as you age, as you age older, that test list increases. But when you're young at 20, like, yeah, go get your blood work done and maybe, get the scan done. But, it's not that much actually. And then just know where you're at. And then do it once a year at least. So you just know where your progression is. It's so much easier to fix little things now, obviously, than to end up in a situation where you need to take a shot every 2 weeks or take medication, lots of medication every single day. It's just actually quite annoying.
Really?
I used to take supplements every day, and I got so sick of it that I was like, okay, I'm going to just force my diet. Like, I need to I need to figure out my diet at this point, because it's just a lot easier if you just get in the habit of eating the nutrients you actually need than to like
Really?
stick, like 10 pills down your throat every single day.
Yeah. So for Instalab, are there hurdles coming up or things that you're facing right now? You wouldn't mind sharing with the public, maybe someone can listen in and help out.
Nothing that for us, we're focused on growth now, and so we feel we have a pretty good set of. We have some products out there that are really good, and so I would say the main thing is, I don't know the demographics of your listeners, but I'm guessing
25 to 35-year-old men.
Yeah. Yes. Yeah. There you go.
80%.
And so
there's some old people, which I don't. There's like 5% that are 65. I don't know who they are. I know who one of them is. I don't know the rest. If you're over at 60, please message and leave a comment. I want to know how you found this. But yeah, sorry for interrupting.
No, so 25 to 35, like our sweet spot is late 30s to early 40s. But if you're in your 30s, like my encouragement to everyone is, even if it's not with us, if it's too expensive through us, like there are you can email me too saying, actually just get my email out. It's like, if you can't afford what we have, just tell me what your budget is, and then I'll attempt to find the best combination of things for you to do. But yeah, it's like I think everyone should set aside an annual budget on health, and then figure out what the things they should do for that and just spend it. And then obviously that budget probably increases as you get older, or it's higher because you've got other risks. But yeah, I think more of asking for help. It's just like asking people to help themselves is the main thing that I want people to do. And if you're in your 30s, like I said, like get that blood work done. If you're in your 30s, you probably have parents who are in their 50s and 60s, like get on top of them now. And it's so easy to just understand where you're at. It's just so easy now. Like there's so many of these, it's not just us, there's so many of these blood testing companies out there, testing everything companies out there. Like you can find a place, I think, within your budget range to get started.
So then what would, 2 follow-up questions. What is like an average, like 1 year, if I were to like go with you guys, for instance, like you can like guinea pig me in terms of an example.
Yeah.
But what would be like the cost, like on average, for like maybe use you guys for a year?
How old are you, if you don't mind me saying?
Well, I'm 32.
Okay, early 30s, and you've got a family history of early heart disease, right? That's kind of
my dad had potato heart. He smoked a lot though. He kind of did it to himself. Dad, if you're listening, it's your fault. But anyways, yeah.
But for you, like it would be, I would say $300. Early 30s, $300. Get your blood test done. Just see where you're at, and then if it flags something, then maybe there's something to work on. But there's not much else to do. Like it's that, and maybe if you got potentially metabolic issues or weight issues and stuff like that, maybe you can get a Dexa scan done too to understand where your visceral fat is and your muscle masses. But otherwise, I would just say blood work is a good first step, and will get you much further than, like I said, like the blood work gets you like 50% of the way there already just by doing that one test. And then I think it's blood work, and then also blood pressure. So just like getting, blood pressure monitors are like $15 these days. You can get one and just, make sure you are on track there. If not, work on bringing it down. Blood pressure is like one of those, again, weirdly it can be overdiagnosed, but it is. I feel like not many people know. There are more people who do not know have high blood pressure, but do not know. But there is this thing if you go to the doctors and you score high on your blood pressure, it's called white coat hypertension. Have you heard of
Yep.
this? Yeah. And so that's why getting your own blood pressure monitor is a better form of diagnosing hypertension than going to your doctor's office. Yeah, those two things I would say: blood pressure monitor and blood work. There you go.
Sure. I think that's very affordable for the majority of. I mean, the majority of people listening are more or less my age, so that seems pretty affordable. And it's basically less than like a Prime subscription for a year, or they're like about the same thing. So if you really think about it, like from affordability standpoint, you could like cut back on like a Netflix or something. Take care of your health.
Yeah.
Maybe go outside more instead of watching TV.
Yeah, you know the one thing
I was watching this.
Yeah, exactly. Yeah, go on and get some sun. I think the one thing I should do is implement like Klarna or one of these buy now pay later things where you can do a monthly plan. So it's like $40 a month and you get the blood work done and stuff like that. Maybe I'll put that close to the top of my list to get done because I feel like that does make it more workable.
Yeah, like lay away for your health. I don't know.
Yeah.
I'm sure there's a way to do it. But you have to like be locked in because it'd be unfair for me to like pay like $10 a month and then like stop it on the second month and get all the results. That'd be unfair to you guys. Yeah. But so like as long as people are like, I'm paying the whole thing,
Yeah, no, there are these companies like a firm. I don't know if they do health services, but I think Klarna, like some of these companies have well, I guess they come after you if you don't pay, and it's not us doing it. So it's sort of just like outsourcing the loan and to them.
Yeah, and most of the time you don't even need to pay. If a company sends you to collections, just tell them you're going to file for bankruptcy, and they'll settle for like pennies on the dollar. This is not advice. I'm not saying you should do that, but like like people talk about like needing to declare bankruptcy because of a medical visit. It's like I don't know, just tell them you're gonna tell them you're gonna file. Tell them they're gonna file, and they'll be like, "How about $10?" Like they don't care.
Yeah. But okay, so then so I'm sorry. Go
ahead. No.
I was gonna say if you are really on a budget, like you've got $50 to spend, like there are places you can get like there are a set of tests like it would be insulin. At least there's like a set of like small set of tests if you're young. Only if you're young. If you're older, you should not just rely on these tests, but that you can probably get like $100 or less get done, and then be on your way. I mean, it's going to tell you less of a picture, but at least you know something.
Yeah. So no matter what, everyone should be bombarding Adora and Instalab because the invitation is there. I do have kind of like a nuance. I don't know how nuanced this is, but you mentioned like budgeting based on your age, and I think that's kind of an interesting concept. So if you're in your 20s, 30s, and I guess that like one 60-year-old out there, there's like I think there's like 250 60 to 70-year-olds. For love of me, please, someone write in. Tell me why you're welcome, but I want to know. Like what would be like the budgets? I imagine like the 60, 70-year-old, the budget is probably like 10 times higher than everyone else's because of their risk profile. But what is like the rough if I'm 20, X 30, what would it actually look like? What would be like a healthy budget?
I think 20 is getting your comprehensive blood work done, and that's $300 a year. It's good. I mean, there are places. It's like $300 to $500 a year. So like you said, when you put it monthly, you save it and do it like in December or something. That could be helpful. When you get into your 30s, it's about the same thing. I think it's more of also what are you gonna like? You're gonna do this test. Okay, are you gonna do anything about it? And if you are, then you want to probably do more testing in that year that you're making changes, just to know that those things are working. So, for example, if you're going to try to lower your cholesterol, then you should be changing your diet. You don't need to take that comprehensive blood work, every 3 months, but you should at least be checking your lipids to make sure what you're doing is actually working. And so that would increase your budget to maybe $100, $200, so maybe $500 if you're actively working on something. And again, it really depends on what you're working on. So, if you're trying to lose weight and lose body fat, then maybe a Dexa scan is more your speed than blood work. And the Dexa scan is, like in New York City, it's like $300 to do. It's ridiculous. Mm-hmm. But in LA and San Francisco, it's like more like $50, $75. So it's much more, approachable.
And then what about the 7-year-olds? Just to make sure I'm covering my bases.
Well, they're covered by government healthcare.
Okay, they don't even
And
care.
so it's easier. We still have people past 65 use us, and I think it's more for the convenience factor than
Yeah.
um, anything else. But yeah, but I would want to say is there are you can get those MRI scans. They're not like the Pernugos are not covered by anything. So for them though, I feel like what they need is almost covered by insurance actually.
They just need to
But
talk to someone who's an
yeah,
expert, like smart, that can
yes,
help them.
exactly. It's the
They can
what's
still
not
go to you
probably
guys.
covered is yeah, what's not covered is probably just these much more advanced tests, and then if you're talking about like minimal budget, I think
Yeah.
insurance, the testing there is covered. What might not be covered on the minimal budget is, like you said, talking to someone like a physician who can really understand them and help them out.
Yeah. All right. So what books are you reading or would recommend? Because I clearly need more. I need to read more, Adora.
I am currently reading a book about Henry Kaiser from Kaiser Permanente. Um, that's the big healthcare system out west.
Okay.
He is also like I didn't know until I looked more into it. He's the one of the big builders of all the dams and you know infrastructure of America. Um, and so I just started reading about him.
I have a book for
You
you.
know that book?
I have a book for you. You should read this.
Oh, the
You're in New York.
Power. Yes.
Yes, I recommend this.
I've read the book. It's
Okay, never
it's
mind.
a great book. I've also seen,
Yes.
there's a play also that was here that I saw too. Who was in it? Ralph Fiennes. Ralph Fiennes
Yeah.
was in it. Yeah, amazing. I mean, controversial figure, but he did a lot for New York that we can all appreciate today.
Yeah.
Yeah.
If you're a wealthy white, you love what he did. If you were anything else, you would not like what he was doing.
German, and then yeah.
Yeah.
I don't know, like some of the bridges and I mean, just making trains
they're
a little bit
nice.
more accessible. But yeah, but he did, he did run over a lot of groups of people and places to get
He
what he
hated public
wanted.
transport. Even though he never drove, he had a driver paid for by the government, so public transport, drive him
Yeah,
around, but he hated anyone else having public transport. The guy was a
yeah,
little shit. But yeah, he did a lot.
yeah,
He did a
yeah,
lot of
yeah,
things.
yes,
It's basically like that Augustus, like I found Rome, like a bunch of huts and I left it a city of marble. He kind of did that to New York City. Granted,
yeah,
he was like the only guy who could take the WPA grants from the government during the Great Depression and the New Deal and like funnel it anywhere and actually
yeah.
translate it as anything useful. He was like the right smart guy. Okay.
Oh,
I'll check out your book. As the
yeah.
last question, learning with Lowell, that's the title. So I must learn what you are
Mhm.
currently working to learn about. What are you like actively trying to learn a lot about?
That's a good question. I'm always learning something in medical stuff.
Mm-hmm.
Trying to think, what have I been actively um I'm
Well,
learning a
things.
lot right now about insurance,
Oh,
health
I hate
insurance.
insurance.
I've always just assumed what we do would not be covered by insurance, but there are avenues, I suppose, that could possibly make it possible. So, if you have a book about insurance back there,
I'm
I
trying to
could use the
find
book.
it, but it is technically rude not to look at you while you're talking.
No, it's
I
fine. If you
do.
can find the book, I would love it.
Oh, I'll follow up because there's two books.
Okay.
One is a Pulitzer Prize winner. I think it's by someone named Starr.
Yeah.
That goes through like the making of American healthcare. And Starr, I think, was one of the people who did like the Affordable Care Act. But I'll follow up on that.
Okay.
All right.
Yeah.
So you're trying to learn
You
more
have
about
a
insurance and how terrible it is. But go ahead.
Oh yeah, well, I know how terrible it is, but I'm just trying to figure out what the ins and outs of it and what's possible with a preventative approach, like where can things get covered. And we started doing a lot of this stuff like prior auth and trying to help people with more expensive stuff get covered, like when they actually need treatment. Um, and so I've been learning a lot about not reading, but just experiencing it and talking to people who are trying to build solutions to basic things like, does my insurance cover this? You'd be surprised that there's no software that actually does that well.
Yeah.
But that would be nice if it did. The insurance, I don't think the insurance companies would appreciate that software being out there, but I wish there was.
They make enough money. They double dip. So the book is
Yeah.
called The Social Transformation of American Medicine by Paul Starr. That's the
Okay.
book. It's very good. It is very dense. Yeah.
Okay. I
So
like
if
that
anyone
stuff.
else has anyone else with recommendations, please send them in. I'll send them over to Adora. But
Yes, please.
Adora, thank you so much for giving your time today, for being patient with me and the problems at the
Of
beginning,
course. No
and for
worries.
being on the show.
Thanks for having me.